Good morning, everybody. Distinguished speakers, colleagues, ladies and gentlemen. My name is Anders Malmberg, and I'm the Pro-Vice-Chancellor of Uppsala University, and it's my pleasure to welcome you on behalf of the steering board to this first edition of Uppsala Health Summit and the conference Healthcare for Healthy Aging. We live in a fast-changing world, and we gradually get older. The share of elderly people in total population is growing in virtually every country in the world. According to data and models from the World Health Organization, the global population aged 85 plus will increase more than 3 times between 2010 and 2050. We grow older and we, in many ways, manage our daily lives better, but the prevalence of poor health is actually increasing. And in Europe, the number of remaining healthy years at 65 has come to a standstill. I think most agree that an aging population is an asset to society. It's a positive sign of the human capacity to implement and take advantage of new knowledge. At the same time, healthcare is faced with great challenges, like budget constraints and ethical dilemmas. Innovations and new technology give us new solutions, but many of these solutions do not reach patients. The idea behind Uppsala Health Summit originates from a long-felt need. If we only dare to see and talk about the difficulties in implementing research and innovation, we can make better use of them and improve health and care. That is why the partners behind Uppsala Health Summit decided to convene decision makers and opinion leaders to high-level dialogue on how we can make the utmost of research and development to meet the challenges ahead. Of course, we are not alone to have thought about these issues. For example, as part of the European Union Innovation Agenda, a new so-called Knowledge and Innovation Consortium, a KIC, will be set up in 2014, focusing on innovation for healthy living and active aging. The Scandinavian node, with universities and companies from Sweden and Denmark, is preparing an application through the consortium InnoLife, in which, for example, Uppsala University is a very active partner. The World Health Organization also has several initiatives in place. For example, Health 2020 is a policy for the European countries with a goal to, and I quote, improve health and well-being, reduce health inequalities, strengthen public health, and ensure people-centered health systems that are universal, equitable, sustainable, and of high quality, end of quote. It is clear that these issues are important on many levels, and the key to getting a result, we believe, is dialogue across organizational, scientific, and geographical boundaries. This year, Uppsala Health Summit will discuss how we can meet these challenges and reap the advantages of an aging society with a focus on healthcare needs and possibilities. The summit is a place where you can listen and learn, but it's primarily an arena for active dialogue. Throughout these 2 days, you will be invited to share your experiences, views, and ideas in plenum, around the tables, in the workshops, and of course during breaks and meals. Uppsala Health Summit should be an arena for frank and open dialogue that brings new insight. Thus, we invite you not only to point out possibilities from innovation and research, but also to raise your concerns. Be inspired by the keynotes and plenary discussions and bring your views to the workshops. For the workshops, we suggest the application of the so-called Chatham House rule, of which many of you, of course, have heard. Anyone in the meeting is free to fully use information from the discussion, but is not supposed to reveal who made specific comments on interventions. The rule, of course, is designed to maximize the openness of discussion. I would like to take this opportunity to thank the Program Council and workshop groups who have prepared the program together with the project management. Thanks to your work, we can look forward to 2 really exciting days. I should also, or I've also been asked to remind you of tonight's conference dinner at one of Uppsala's traditional student clubs, Norrlands Nation. This club has a history dating back to 1646, even though the building we'll be in tonight is as recent as 1889. If you for some reason haven't signed up for the dinner, you'll probably regret it, but talk to the information desk during the coffee break. They might be able to settle this for you. I will now give the floor to our two moderators, Annika Dopping and Richard B. Saltman. Annika Dopping is an experienced journalist as well as a qualified moderator with experience from both Swedish and international meetings. Richard B. Saltman is Professor of Health Policy and Management at the Rollins School of Public Health of Emory University in Atlanta, Georgia. He often moderates these types of meetings and has a thorough understanding of the issues under discussion. So please, Annika and Richard, the floor is yours. And once again, to all of you, a warm welcome to Uppsala and to the first Uppsala Health Summit, hereby declared open. Thank you.